You're listening to In Sickness, a podcast about caregiving with Allison Breininger and Justin Bima.
Hi, Justin.
Oh, good morning, Allison.
How are you? What's going on?
Well, fall's definitely setting in. We're kind of getting our first big rainstorm of the season, which is, I don't know, I feel the sort of gloominess of the long winter ahead setting in a little bit,
yeah.
which is, I don't know, it is what it is. But we've been starting a new project here.
Yeah.
In this last week, when Sarah and I moved in with her parents, I think it's 4 years ago now, we moved very quickly. And, there was, given that we were moving into their house, which already was furnished with stuff and full of stuff, we had boxes and boxes of furniture and things that we didn't need anymore for this living situation. At the time, we didn't know if this was a short-term, long-term, kind of the duration of it. And so that all just kind of went into the attic in my parents' shop, just kind of as storage. And it's just been sitting there kind of ever since.
And now you're digging through it?
And now we've started to dig through it. And yeah, because Sarah's finally at a point where she feels like she has the energy and kind of mental capacity to be going through that.
Yeah.
And it's kind of been this just weight a little bit of just all of this stuff that's just there that, at some point we're going to have to deal with. It can't just stay there forever. So we've been started with our first load of boxes and going through that. And most of it's just getting donated because we haven't needed it in so many years. But it's an interesting, kind of time capsule of our life at that time. And it'll kind of be interesting to see, what it's like digging through all of that stuff that, some of it is stuff from before Sarah got sick. Some of it is, it all happened when she was at her worst. It's just kind of a look back at a different time.
Yeah. When you said that when you first boxed it up and you were quickly moving and you didn't know if it would be temporary, is there any sort of a resignation of well, the fact that we're getting rid of these boxes means that this isn't temporary. This is for real. You know what I mean?
I know what you mean. I think that that's already happened. We're both just really happy, and Sarah's parents as well, with our current living situation.
Good.
And so it's not anything like that. Yeah, we've already kind of all feel great about the situation and happy with that. So
good.
But it is just, and it's gonna be a lot of work.
Yeah.
But it feels good to be at a point where we feel like we both can take it on.
Yeah. That's huge.
And so, we'll see what we dig up.
Right. It's interesting, especially with, I feel like in COVID, it's sort of what is time? And so for you to have this little time capsule to be 4 years ago, this is what our life looked like.
Yeah.
So that'll be interesting to go through. I'm so glad that you are in a situation where all four of you are yep, this is not that this is your dream, right? You would wish to need to live with your in-laws, but that you do, and that the four of you, it's a good situation. I mean, that's amazing.
It's been really great. Yeah.
Yeah. Yeah. Oh, good. Well, good luck with the boxes. I'm glad just the fact that she has energy to do it says something. Yeah.
What about you? How are you doing? How's your week or weeks been since we last talked?
Oh, friend, it's been pretty rough.
Yeah.
Pretty rough. So many things. But I'll just pick one for today. Okay. How about that?
Because we can take one for today.
We only have so much time together, so I'll just pick one. So, as you know, at the end of July, I left my job, and so in leaving my job, we took on new insurance. And Sean did a lot of research to pick a new plan.
Yeah, we had
it in our mind that because he's on Medicare, that he would need to get a Medicare supplement plan, and that he could not get a Medicare, a secondary private plan.
Okay.
So he found a Medicare supplement plan, found the very best because he gets all the things, right? So got top of the line plan as of August 1st. So a week or two ago, I was talking to the home infusion folks and ordering some supplies. And Sean said, just make sure that they have our new insurance. I said, oh, I think they do. And he said, just make sure. So I asked him and they said, oh, no, we don't have that in our system. So I gave him the new information. And then they said, okay, well, we'll look into it. And if there's any decisions that you're going to need to make, we'll call you back. If you don't hear from us, then you should be fine.
Okay.
So I knew when she called back that we were in trouble. And so what we found out is that Medicare does not cover the two things that they are supplying us with. One is that he has a G tube, a feeding tube.
Mm-hmm.
He is able to eat by mouth, but he's a little tiny guy and he doesn't love eating. He's not usually very hungry. And so he has this extra, it's like 500 calorie formula that he does once or twice a day just to keep his calories up.
Right.
And he's had the G tube for a long time because he's had so many mouth and throat and tongue surgeries that it's just good to have that. So we found out that Medicare will only cover nutritional supplements if the only way you can eat is through your G tube. If you have the option of eating through your mouth, they will not cover it anymore. So that one feels hard, but we can go online, we can go to the pharmacy and we can get Boost. We can get 500 calorie Boost. We would have to pay for it ourselves, which is a bummer, but it exists.
Right.
I could go to CVS right now and get that.
Yeah.
So that feels like frustrating, but like, okay, fine. Right.
Right.
The big one is that he also does IV hydration every day and has for the last 2 years. Right. And they said that Medicare does not cover that.
Oh.
And, and so you hear that and suddenly you're like, what question am I even supposed to ask?
Yeah.
In response to that statement. And so I was just like, what do you mean? And she's like, they don't cover it. And so we have spent the last week and a half trying to figure out, because he does this every single day.
Yeah.
Like, what are we supposed to do with this information, knowing that this thing that has really kept him out of the ER and out of the hospital? Because before, often he would get infections, he would get sick and he would get dehydrated and we would end up in the ER and he would be septic. And often they would give him fluids. And then that was like the first big step. And so it was actually my idea 2 years ago that I said, could we just do this at home? Like, could we preemptively continuously give him fluids to keep him out of the hospital? And they were like, sure. So it's been this slick thing we've done for 2 years. So to hear that it's not covered, it's like, I don't even know how to process this sentence. Right. So it's been a week and a half of trying to figure that out, figuring out things like, what if it's not in a pump, but it's in a bag? Nope.
Right.
That's not covered.
Okay.
Trying to figure out, like, how did we miss this? And like going to the website, where on the website it says, we cover home infusion supplies. And then, but you have to like go into like Appendix H kind of thing, where it says, these are the 5 home infusion supplies that we cover.
Oh.
And none of them are the same as what we need.
Right.
So it's been a nightmare.
Yeah, I can imagine.
I have been thinking about it in sort of like 3 different buckets. One is that like, we're going to probably get an enormous bill from August 1st to September 20th. Right. Or that for the things that we ordered without realizing. Yeah. So that's going to happen. And then there's now, like, he is out of supplies. Like, we have not ordered more. Right. And so, like, what do we do right now in this moment? What do we do for him? What do we do to fight it? What do we do for all those things? And then the sort of the future bucket is more about like getting him a new plan. Right. And how quickly can we make that happen? So I'm ready for questions and comments.
Well, that's a lot.
Oh my gosh.
And like,
so much.
I am like Sarah has infusions that she takes every day, and that made a like night and day difference in how she did. And so just imagining like, if for some reason we were no longer able to have that for her, like that would be just devastating. Yeah. And so like, I feel for you. That's really, really hard. And yeah, it feels just so frustrating, and like, I feel mad for you that like something that has shown to help and like keep him out of the ER. Yep. Like, because of the like broken healthcare system in this country and just the like mess that is like medical insurance, like that, that it can't continue. Like, that's just, it's not right. It is not right. And, you and I are both in situations with our spouses where they have diseases, illnesses, conditions that there's a lot we don't know. Right. And so there's a lot of things that we're hoping for a cure, and we're hoping for, if only there was this thing. Right. And so I have lived that life a lot. Of like wishing there was a treatment. This feels like so frustrating because there is something. Yeah.
There is something that I could make a phone call and it could be like literally delivered to my door and I could give it to him and it would make him feel better.
Yeah.
And yet the bureaucracy is saying that I can't. Actually, they're not saying I can't. I could, but I would have to pay for it.
Right.
And we think we're not waiting for the bill. We're dreading the bill. But we saw an explanation of benefits that makes it look like I think that it's probably around $5,200 a month. So then we are in the situation where, because people are like, well, just order the stuff. Like, you should still pay for it. His health is so important. Amen. His health is so important. Yeah. And we have to be in a situation then of deciding, is it $5,200 a month important? Like, is there a workaround? Like,
yeah,
you don't ever want to have to put like a price tag
that's
on
like
your person's health. Right. And so I feel irresponsible in the fact that like I didn't order more supplies. But I also don't know if I would have felt responsible if I had ordered the supplies. You know, because that's not good for our family either.
Yeah.
They have to spend $5,200 extra a month. Like, that's not gonna it's gonna impact us negatively in other ways. I will say that one thing that they said that we could do instead is that every single day, 7 days a week, he could go to an infusion center.
Right.
So you think about this, maybe you've heard there's this pandemic.
Yeah. Yep.
So already he's having all of his appointments online, like where we're trying not to go to the clinic. But you just think about how much more money it costs the system, you would think.
Right.
For us to go there and the space and the nursing and the right? Than me just doing it here.
Right.
Right. And I know in the past, I will say, I know in the past we have been frustrated and have talked about like how we don't like being as caregivers. We don't like the fact that the system usually takes advantage of us and is like, they're cheaper. Right. But in this situation, I'm like, guys, it would be cheaper and safer. Yeah. To do it here than for 7 days a week. And I just think there's no way he would be so shot even if there was no COVID. He would be so shot.
Right.
If every
just the fatigue from doing that every single day. I can't imagine.
No way. Yeah. Yeah. No way. So I think like the weight of this responsibility feels so huge. Like, we researched this plan. We really, it is the best plan.
Right. Yeah. You did everything you could. You did everything right at that point. And it's like.
And I keep replaying in my mind because I really feel like I had the conversation with the guy, the intake guy, and saying like, hey, we got new insurance. And I thought he had said, oh, I'm sure it'll come through, it's fine or something. I don't even know. But I'm like, did I dream that? Did it happen? Is there a record of that? Because if there isn't, then there's nothing we can do about this enormous bill that's about to come. Right. But I'm like, I really think I had that conversation. Right. So now that's weighing on me. Did I not? Did I, yeah. And then also trying to make decisions now about like, how do we keep him hydrated? We're thinking about putting water through his G tube. Okay. Like, that's not as good because it doesn't go through your system. It's not saline. It goes to his gut. That doesn't make him feel great. You know what I mean? But it's like a workaround. Yeah. For this moment. We have found this place. Actually, this is a great resource for folks listening. It's called the Oley Foundation, OLEY. And it's like when people have extra medical supplies. Oh. And they can donate them and you register for free. And then you can like sort of shop in their little store of stuff they have. Oh, and then they send it to you. And the only thing you have to pay is for shipping. So I've heard that we can probably get, I don't think we're going to be able to get hydration stuff that way, but I think the food stuff we can get that way. Yeah. So I will say that like people have been coming out of the woodwork. We are so fortunate. We have an amazing community. People are coming out of the woodwork with like, have you tried this? Have you tried this? Here's $20. Here's call your congressman, get an ombudsman. And I just have to tell you, like, I'm grateful and it's so exhausting. Yeah. To be told like, you know what you should be doing right now, Allison? Contacting your congressman. Yeah. What? I have a friend who's currently fighting the system as a caregiver as well. And somebody told her that. She's like, right, yes, exactly. Because do you know what I have time and energy for right now? Right. Is to be a political advocate. Yeah. She's like, I'm so fired up right now. If I called that congressman, I'd probably be put on the no-fly list. I would start saying things that are not appropriate. So it's so hard because, again, I don't want to be irresponsible and like not do everything that I could possibly do. At the same time, like, what do you mean? Call my what?
Like, how is that? The fact that that is a potential solution is also just maddening.
Yeah.
Like that the system is so broken that like
right.
It's some sort of like Hail Mary to a politician who
right.
I don't know what. Presumably they can do something, I guess, but like
right.
It just feels that's hard. And like, yeah, you've got your plate was too full before this all happened. And like this has added like multiple new things.
I know. And I have to say that I am super well resourced, right? Like I've got a great community, I've got great friends, we have a savings account, like I have a master's degree. You know what I mean? Like we are well connected,
right,
and well resourced. And it's not like, I mean, I don't know how big this bill is going to be, so maybe I shouldn't make a definitive statement. I hope it's not that we're not going to be able to like pay our heating bill, right? When this comes, it's going to be bad, right?
Right.
But but it just makes me think about all the other people.
Yeah. People who don't have the resources or the time or the like, who don't have a caregiver to advocate for them.
Right.
You know, like, just lost in the system.
Totally. Who don't have, I mean, if I'm feeling like I can't call my congressman, like how is the regular, you know, like, just. Yeah.
It's the medical system, the insurance system, just all of that is just so bad. So broken.
To watch Sean have to sit here and listen to, you know, conversations that we've been having about this. And then he's like, it's fine. I don't need it. You know, like he's sitting there feeling like I'm not worth all this. Like I'm not worth $5,200 a month. Like I'm not worth, like, I don't know. I'll just try to drink more water. I don't know. You know what I mean? Like, like must be a terrible feeling for him.
Right.
To be thinking about like, how much is his well-being? How much money is his well-being worth?
Yeah.
Like we should not have to ask ourselves that question.
Right.
Nobody should have to ask themselves that question.
No.
And that is exactly what he's thinking right now. It's not okay.
No. It reminds me a little bit. I mean, it was a different situation, but when, you know, I talked about Sarah has this, we just call it her headache magnet, but it's a medical device for her migraine. Right. And it wasn't that the device was no longer covered. I mean, at that point we hadn't been able to get it covered, but the business just went away. That like, and then something that had made a huge difference in her life was just poof gone.
Right.
And it's helpless.
And you're like, it's right there.
Yeah.
It's right there.
And
you just need like a battery
chip
or something, right? Yes.
We just need a little card to put in it. And then, and I mean, thankfully that ended up coming back around for us. But I mean, that feeling of something that like, it's right there out of your reach that, you know, like, you know, you're not searching for a treatment. You're not searching for something like that. You're just stuck on the bureaucratic side of it. And that's not, it feels like such a waste of your energy to be stuck in that place.
Oh my gosh. Yes. One day I had put in an order. Then I found out it wasn't covered. And by the time I called, it was too late. They had already shipped it.
Oh.
And I said, I'm going to refuse this shipment. Like, it was 3 huge boxes of the supplemental formula. I was like, I don't know. I don't even know how much this would cost. And so so they just said, like, don't let it in your house. Cause once it's in your house, we can't take it back. Call us and we'll come back and pick it up. So I was like literally sitting on my front steps next to these 3 giant boxes of materials that we wanted and needed and wanted to bring inside the house, and waiting for the delivery truck to come pick it up and take it away. And then the lady called just to like rub it in later to be like, the delivery man just brought your husband's supplies back. Was that a mistake? And I'm like, nope, not a mistake. Thanks for calling, you know?
Yeah.
So yeah, it's like, it was like literally like sitting next to me, the things that we needed and wanted. The other thing is that, you know, because he has this PICC line, which is where we do the hydration.
Yeah.
He has a nurse comes to the house once a week. So she comes and she changes the dressing, and then she draws labs and then does vitals. And we found out that they're going to cover that. Like it's going to be like a 10% coinsurance. Now, I don't know what that number is going to be.
Yeah.
Right. But so then he's starting to say, well, if I can't get the hydration anymore, maybe I should have my PICC line taken out. And I'm like, well, but we might be able to get it for you later.
Yeah.
And you don't want to go through it. And he's like, I know, but is it cheaper? We know that like hospital stuff is covered. So is it cheaper to have it pulled out and later put back in than to pay for the nurse? I mean, these are the kind of conversations we are having.
Yeah. That's
what I might need to stop and have a stiff drink in the middle of this podcast today at 11 a.m. on a Saturday.
I feel for you.
Getting all riled up. Have you, besides the headache magnet, have you and Sarah had to deal with any kind of bureaucratic garbage?
Yeah. I mean, we went through, when Sarah was at her worst, those like 3.5 years when she was in bed pretty much, like just existing in a dark room, we went through the process to apply for disability for her.
Oh, yeah. Yeah.
And at the time, her primary diagnosis was fibromyalgia. I don't recall if she'd been diagnosed with POTS yet or not. But it was primarily the fibromyalgia, and doing some research, like we knew that was going to be difficult to get approved just because the understanding of that condition within the bureaucracy isn't like reflective of like the severity that it can have. Like she was clearly extremely affected by it, but that's not how it's necessarily seen through the process. So like we knew it was going to be difficult, so we reached out to like a lawyer to get involved from the start, and they're like, yeah, you have to go ahead and apply and you're going to get denied, and once you've been denied, then we can try to help you. Which is just a really frustrating way to start the process.
Yeah.
And so I went, and it was a mountain of paperwork. It was years of medical records, gathering them from, the various doctors that she'd been through, and chronicling all the different medications she'd tried to help different things, and, going through what her symptoms were and all of that, and then sending that off. And then, knowing that we'd hear back and that it would be denied. And then at that point, we met with a lawyer, and
so it was like it did come back denied.
Yeah, it did. Yeah. And so she was like, this, we call fibromyalgia the F word within this, because it's just not, your odds are not great at all. And, during this meeting, like Sarah, they had a like, whatever room we were meeting in had like a love seat in it, and she was like laying down during this meeting because like she's that like, doing not well. And so like we went through the next step and appealed, and we ended up, she had to go before a judge.
Okay.
Who then,
Sarah did, or the lawyer did?
Sarah did, with the lawyer.
Okay.
And so a single person was going to like decide whether, Sarah was sick enough to be on disability.
Oh my gosh.
And, so just that was a stressful thing for her. And, just to like, that's how the system is built, such that you have to be like, basically how well of an interview you are.
Right.
Depends on it. And there's so many people who like don't do great in those situations, or physically can't make it in person to like.
Which, think about the irony of that.
Yeah, exactly. Right. It's like the built-in ableism within the disability system is just.
They're like, oh, you're well enough to be standing here, so you must be fine.
Well, and basically that's what some of the things the judge said was like, she like was dressed nicely and had showered, and like, and what does that tell you about how this person views disabled people?
Right.
And like, like I helped her shower for that. Like she's there because I helped her get dressed. Like,
right. And how much did that knock her out? Like, so she was there for that chunk of time, and then what was the, what I mean? Like,
probably several weeks she was out of commission after that. Yeah. And, I mean, the hardest part of that being with the lawyers, like I had to wait in the hallway. Like I wasn't able to be there to like, just be there next to her as a like supportive spouse even, or like to advocate in any way. I was just in the hallway, just, waiting. But it was a terrible experience. It was,
so what was the outcome?
yeah, so after that, we waited to get the ruling in the mail, and she was denied.
Oh,
Um,
man. So
I
she
think
had
that
gone through that whole thing, and then they still.
I think in his ruling or whatever, he cited that because part of it is they're like, if they try to determine if there's some sort of job you could do, and if they
Right,
think there's
right.
some job you could do,
Right.
then they'll deny you. And so like he cited that he thought she could be a waitress. It's just like, how detached from like what
No.
you like, where did you get that? Like, did you even go through
Oh
any of
my
the
gosh.
paperwork? And it was just such a frustrating, like dehumanizing
Yeah.
experience for her.
Yes,
And
that's
like,
exactly the word. Yes.
just so broken. And so,
Oh.
yeah, that, and
So to
then
this day,
we were
she has
done.
never been approved.
No.
Do you think, not to like open old wounds, but do you feel like now that she has additional diagnoses, would you ever consider trying again?
I don't know. I think it like just like emotionally it was a really difficult process.
Yeah.
And
Yeah.
I don't know if she would want to do that again
Yeah.
or not. Yeah.
Ugh. So again, it's sort of like the boxes of supplies sitting right there
Mhm.
next to you. Like
Mhm.
the help is right there.
Mhm.
It's right there.
Mhm.
It's just that some person has decided that you can't have access to it.
Mhm. Yeah, the fact that, we're doing all of these things already to like help our person just day in and day
Yeah.
out. We're,
Yeah.
dealing with the actual medical side of things,
Yes.
like finding treatments or, working with medical staff, doctors, nurses, all of that, doing care at home,
Hmm. Hmm.
with infusions and things like that. And then, yeah, the whole bureaucratic side of things is just, I hate it.
Hmm. Yep.
Um, that
I
it's
mean, we've
such,
talked in the past about you and I, like, how much time should we spend researching? Like, and we're talking more about
Mhm.
like for cures and stuff, but like,
Yeah,
you think about the time, like, again, how much time should we be spending researching Medicare plans?
yeah,
And in our house, we really thought we had. And,
mhm,
how much time should you be researching disability law, right?
mhm,
Like, you and I are smart people, but those are not our areas of expertise,
right,
right?
yeah.
Because I would guess too, I mean, you probably had to pay for that lawyer, right?
Had she received disability, the payment would have come out of that. So we didn't have to
Oh,
pay.
okay, because she didn't win or whatever. Okay,
Right.
I see. So that just makes me wonder though, like if when you said that they said that the fibromyalgia is like the F word, then it's kind of amazing that a lawyer would even take on that case, knowing that they're probably going to lose and that they
Mhm.
won't get paid if they
Yeah. Yeah,
lose.
yeah. And
Whew.
I can't imagine trying to do it without someone who at least, like, understood the process that we were going
Yeah.
through.
Yep.
Not that it helped to from, like, an advocating and, like, this is truly what's happening standpoint,
Right.
but,
Right.
um, I can't had she been just all completely alone in front of the judge, like,
Oh no. Mm-mm.
no.
No. We have had so Sean is on disability, and
Mhm.
hearing these stories makes me grateful that he was approved. But I would say that dealing with the disability system
Yeah.
has actually been one of the most challenging for him and like in his headspace,
Mhm.
because early on when had to fill out the paperwork and he had to like go to an office, and he said it was one of those where like people were sitting there like in neck braces, like, I
Yeah.
had a car accident kind of thing.
Mhm.
And he had to, like, again, like it was in a doctor's office with a doctor he had never seen, but it was with the
Mhm.
doctor that he had to sort of prove that he's sick.
Yeah. Mhm.
And I think it's once a year or once every 6 months, we get a packet of papers and we have to like fill them out again. And I try to, like, when that comes in the mail, I try to hide it.
Yeah.
I try to complete it myself without him
Mhm.
even knowing that it happened, because
Mhm.
it causes him so much stress that at some point they might say, "You're fine. You're fine. Go get a job."
Yeah.
And then he spends time swirling and thinking about, what job could I do? Could I do a
Right.
job? Should I be working? Is there a job? Should I don't know, like maybe I could something. No,
Yeah.
no, no.
Mhm.
And so again, like that, you said dehumanizing. I think
Yeah.
that word is so spot on in this whole conversation today, that like
Mhm.
they have to prove, like, here they are just trying to like get through the day and they have to prove like, no, I'm really sick.
Mhm.
Like, is it not hard enough to just be sick? Right? And all the other things, but to have to like prove how sick you are
to
and
someone who
justify it.
seemed like from the outset, like whose mind has already been made up.
Right.
Or yeah, at least that's how it felt on our end.
Yeah. Yeah, for sure. For sure. So I'm fortunate that he was approved, but again, it's an ongoing thing. And even stuff like when Maya turns 18, that's all going to change. I don't know. Something changes when she turns 18. You know, it's just a constant.
Yeah.
Just always wondering if the rug's going to get pulled out from underneath you kind of thing.
Yeah.
Yeah.
And that's just another like administrative task that is on your plate, and another thing you have to become an expert in, and another thing to just be on your mind. It's yeah.
And every person who has reached out to me, then I feel like, okay, maybe they'll have the magic answer. Maybe they'll have the magic answer. You know what I mean? But then I'm like, which of these phone calls is actually going to be fruitful?
Right.
Because I don't have it in me to be, responding to all the people. I mean, somebody, and I'm so grateful that people are just, grasping at straws. But somebody said, my cat once needed IV fluids and we got them from the vet and it was pretty cheap. And she's like, I'm sorry to say this, but could you ask a vet if they could give you the IV fluids? And she was, apologetic and like, I'm sorry to even say this. I'm just trying to help. Right. And like somebody else is like, I work at a wholesale, retail, medical. Maybe I could get you a couple bags of fluid. What? You know what I mean? So it's like so grateful. And like I'm having to sift through piles of unsolicited advice around like, should I go ask a vet? Should I call my congressman? Should I go to this wholesale company? Should I go to this foundation? You know what I mean?
Yeah. How does that feel? Because it sounds like, you shared online pretty openly this Medicare battle that you're going through, or this ordeal.
Yep.
And as you said, people are very well-meaning.
Yep.
But it sounds like you've gotten a lot of unsolicited advice.
Yep. Yeah.
How does that feel to like, because you didn't seem like you were asking for that, but also like it comes down to it, like people don't know. Like, I think those people, they're genuinely trying to be helpful.
Oh, absolutely. 100%.
But it's just, it ends up being just overload for you.
It's true. I think that what I would say is, because there was one person who reached out and her job is, she is a coach for caregivers.
Yeah.
Like this is the kind of stuff that she works on. And she is a former nurse, and the conversation with her was like super helpful.
Right.
Because she does know the system, and I did learn new things that I can try and do that I did not know before. Right. So that was a really helpful one. I think I would say a couple things. One is the friend who reached out about the vet thing, right? Like she was like couched it in.
Yeah.
Like, you can totally ignore this. This might sound ridiculous. I just feel for you. And I just wanted to throw this out there. Do you know what I mean? And so I appreciated that it was not, some things were more of like a directive, like all caps, people saying, call your congressperson. And I'm sort of like, don't all caps me. I'm tired.
Yeah.
You know what I mean?
Yeah.
So I think, like, what if the vet thing was like the magic bullet? Like I'm glad, I guess, that the person reached out, but I think always to couch it in like, this might sound crazy. And you can totally ignore this.
Yeah.
You know what I mean? And so like, no need to respond, that kind of thing.
Yeah.
I appreciate a bunch of people just like Venmo'd us cash and they're like, this just whatever you want to use this for, go buy yourself a taco. You know what I mean?
Yeah.
Because like that just felt, even though we don't know the number yet, not knowing the number almost actually feels worse.
Yeah.
Than knowing the number.
Because you can't plan for it.
Can't plan for it.
Yep.
So somebody just being like, here's $20. Or it was really sweet. We did find out that like each pump costs like $36. And so a number of people were like sending us $36 to be like, here's for one pump, So that feels helpful. I mean, I hate to say it, but I feel like money always just makes things a little better. Because suddenly I was panicking like, I'm not going to buy that sandwich. I can't buy the sandwich. You know what I mean?
Yeah.
And so I think, as hard as it is to say, I think money always feels helpful. I think some things that I heard, like a lot of people were like, if anyone can do this, it's you, which is a compliment. And it feels like I don't want to.
Yeah.
Or a lot of people are like, you're so strong and your family's been through so much that I'm sure you'll get through this. I'm sure that we will. Right.
But you shouldn't have to.
Well, we shouldn't have to. So I think that those things just be a little, I would just say to supporters, just to be a little bit careful, because they can sound like compliments and can also feel like, yeah, you know why I'm so strong? Because I've gone through so many things.
Mm-hmm.
You know what I mean? And I don't really want to be strong, and I don't want to have to be strong, and I don't want to have to keep fighting. And so I think some of the directives felt not awesome.
Yeah.
Like, keep fighting. Don't give up. Call the people. Like, get mad at them. Ask for their supervisors. You know what I mean? That kind of stuff felt like,
right.
Oh, okay. All right.
Yeah.
Yeah. That's some things I would say. Do you have anything that you would add as a, that you would, you're not exactly in this situation, but that's
no,
supporters.
I was going to tell you to go have a glass of wine on your patio.
Yes. Like you're going to put that in all caps.
I'll put that in all caps for you. Yeah. Yeah. I think generally it's unsolicited advice is because we've dealt with some of that at times, when Sarah was first getting sick with, people, she should, walk more or whatever.
Oh,
and like, well, no, that's actually going to make her worse. But
right.
Yeah, I like what you said about if you really feel like there's something you want to offer, but to couch it in like, hey, this is like, you don't have to pay attention to this if you don't want to. Take it or leave it kind of situation.
Yeah.
And also like, you can also just say, that I'm so sorry. That's not right that this is happening. Like that sucks.
Yep.
Like if you, that a response like that is, I imagine means, as much as anything else.
Yeah. Like it felt like good to my heart earlier when you were like, I am mad. Like I am mad for you. Like, cause mad is like a strong emotion. And so to hear that somebody else is mad on our behalf, I don't know, for some reason to me that feels good. It's not just like, oh, that's too bad. It's like, I'm mad for you.
Yeah.
I'm mad that this is happening, So that, I mean, I appreciate it. And maybe, keep in mind, anybody listening, I'm one person. So maybe other people love being yelled at in all capital letters. I'm just saying, what has felt supportive to me. Or somebody has said, like, if there are numbers, if there are phone numbers, if you need to just make phone calls and you want me to do them, I can do that. You know what I mean? That kind of thing.
Yeah. That's
one thing I started to do because these like texts and emails and stuff kept coming in, is I was essentially like writing up a report of what's happened. So that I don't have to keep repeating myself, so that I can just like, anytime someone says, what about this? I can just go, bloop, here's what's happened, to give them just a little more context, so that if they feel like they can take this information and go with it, great. And if not, then I didn't have to just like repeat myself, Yeah. So yes, wine, patios are good solutions. Money is always nice. I hate to say.
I know.
But I think just in this moment of feeling like, especially because, I just took this leap and we had done a lot of financial calculations that did not include whatever this bill is.
Right.
Right. I mean, I'm sure that we'll be fine. And suddenly I'm like, oh my gosh, do I need to get a job at Wendy's or someplace better paying than Wendy's probably. But,
right.
Yeah. So I think anytime you can like financially support someone, it just relieves some kind of stress in their life. You know what I mean?
Yeah, because unfortunately, like, part of dealing with medical crises is financial stress.
Yep.
And that's the way it's going to be with the system that we have, unfortunately.
Yep. And even if it's like, let's say it's not a financial thing, if someone sends you $20, then you're like, oh, now I can go get that fancy ice cream or that fancy, you know what I mean? Like you can treat yourself in a different way. And so, and a lot of people have been like, you need to start a fundraiser, but again, like all caps. Okay, I'll get right on that. I'll get right on that. And I think I'll just say quick too, that feels, I mean, we might need to, like people want to help, and that's amazing. And we might end up doing that depending on what this number is. But
yeah,
I think it just always then puts us in this, like, we want to be the people helping someone else.
Yeah.
And we're like, well, we are more resource than other people. And so like somebody was like, I'm going to call this clinic and see if they have extra boosts. Then I'm like, well, maybe somebody needs a boost more than we do,
Yeah.
So even that feels hard. But people are like, you can have the blessings too. Like they don't have, like you are in need right now. And I think that feels hard because I like to be the one supporting others, and it can feel hard sometimes to like accept that,
Yeah, for sure.
Yeah.
For sure.
So I should go have wine on my patio, huh?
That's just a suggestion, but
I think it's a great suggestion.
I think it might help.
I think you're right. You're right. 2 quick things I want to say before we
go for it.
Number 1, this is episode number 30.
Yeah. 30.
That's a big deal.
It is. Yeah.
You don't sound very excited.
No, I'm excited. It's we've been doing this for a long time now, and I love it.
I love it too.
And I love that this is a thing that exists.
I am too.
Yeah.
Yes.
One of all the things that I've done in my life, it's one of the things I'm most proud of.
Oh, I love that. Yes. Yes. And you're the one. You were like, let's do this. Let's do it. You were the backbone behind this thing. I just show up and complain about things. So
well, that's what we need.
There you go. Great. I'm glad I have a purpose here. So congratulations on
to you as well.
Number 30. Thank you. The one last thing I wanted to mention is, I think I said this a couple weeks ago, but like Kate Bowler, who I love and talk about a lot here, has this new book, No Cure for Being Human. And it comes out today, the day that this is going to be released. And so I just think, especially as I'm on her book launch team. And so we got these pennants that say No Cure for Being Human on them. So I have that in my office now. And I just think I kind of want to like send it to Medicare, right? I just think that it's such a good title for this is like, we're all human. There's no cure for it. So give us some support and services. You know what I mean? So
yeah, I do.
First of all, I just want to plug the book because I love her.
Yeah.
And think she's a beautiful writer, and is, she writes about her cancer and caregiving and all of that. And so the book comes out the day this podcast will be released. But also I just think like that title is good for us and what we've been thinking about today. So just wanted to throw that out there. So No Cure for Being Human by Kate Bowler.
All right.
Highly recommend it.
Good.
All right. Gonna go pour the wine, sit on the patio. And hopefully, I mean, let's see. Let's just put it on our vision board that the next time we are together, I will have something good. I mean, best case scenario, something good around Medicare to report. But I would just like something good in general, because I feel like
take
the
anything
last
good.
bunch of times it's been a struggle for a while.
Yeah.
So I'm going to vision board that 2 weeks from now when we're together, something good will be ready to be discussed. So
that sounds great.
Yeah. All right. Thanks for talking.
Okay. Yeah. You as well.
Yeah. Okay. Bye.
Bye. You've been listening to In Sickness. Find us online at insickness.care or on Instagram at insicknesspodcast. You can send your questions and comments to insicknesspodcast@gmail.com. If you enjoyed the show, please share it with a friend or fellow caregiver, or leave us a review on Apple Podcasts. Thanks for listening, and take care.